I was one of the responders to the Ebola crisis of 2014 to 2016. By the time it ended in 2016, it had become the largest global health crisis of this decade because of the scope. It's usually said that in crisis, the first casualty is truth. I'd like to say that in crisis, really, the first casualty is trust. And I'll tell you why. From a very young age, one of my earliest memories are of my parents loading us up into the family car, taking my siblings and myself away from the relative comfort of our home to go help communities that were facing some kind of crisis and try and alleviate their situation. And these earlier experiences were what directly influenced my career choice to study medicine. And when I graduated and qualified, I immediately got involved with meeting the needs, medical needs of medically underserved populations around several countries in West and Central Africa, including at the height of the Darfur crisis in 2007, where I was a medical officer with the United Nations. After close to a decade of doing this, I came to the US for some further education. Well, I don't know if crisis was following me, but the next year, in the forests of a tiny West African nation called Guinea, the Ebola crisis started. And cases continued to mount and the disease continued to spread. By early 2014, Ebola had gripped the attention of the world, including Western nations. And in the news, in newspapers, everywhere the cry was about Ebola and what a crisis it was becoming. So as efforts at control continued to defy any attempts at controlling Ebola, reading the newspapers and watching the news, I was familiar with these places and I was drawn to go back. And very soon I realized I had to go back and be a part of the solution to the problem. And I got the buy-in from my wife and volunteered. In September 2014, I bade my family goodbye, boarded a plane, and left for Liberia. On the flight to Monrovia, for the first time, I felt fear because this was a situation I hadn't encountered before. Was I ever going to see my family again? But as the plane got closer to the airport, my thoughts turned to what had changed, like what was going to be different and what was the same from the last time I was there. It wasn't long before I got my answer because as the small handful of passengers descended from the plane, the airport itself looked like a military camp. You had soldiers deployed all over the tarmac. Walking towards the arrival hall at the airport, just a small handful of us, the departure hall was filled with a horde of people waiting to board the plane and leave the country, or flee the country, as it were. On the ride into town, ambulances were everywhere, sirens blaring. You had these open back pickup trucks with people who were dressed in what appeared to be spacesuits, carting away the dead, separating families and taking the sick into isolation. Even overhead, there was a military helicopter flying low, carrying out aerial patrols. And it truly felt and looked like a city under siege. But this time, the enemy was a virus, but no less deadly than if bullets were flying. Now, Ebola is a disease caused by a virus. The mode of transmission is human to human. So efforts at control are aimed at interrupting the human-to-human transmission. So what do you have to do? The responders have to go into the communities, find the sick, and isolate them for treatment. Then monitor their contacts in quarantine for 21 days to make sure they don't fall sick. and then also educate the communities on what harmful practices they need to suspend or stop for the duration of the epidemic. I quickly joined the response and settled into my role as a field coordinator with the World Health Organization. And the World Health Organization had people in all the communities helping to interface with the communities to push back Ebola. Now, looking back at that time, it's clear that underlying the epidemic of a virus was an overlying epidemic of mistrust, as you can also see from newspaper accounts of that period. And many factors were responsible for this widespread mistrust. One, help was slow in coming to the affected countries. Although from early 2014, much earlier in the year, it was clear that the epidemic had overwhelmed the response capacities of the affected countries, the international community was really slow to respond. When help came, enough wasn't done to engage the natural structures in those communities. And this led to poorly crafted messaging, culturally offensive handling of corpses, and separation of sick people from their families. When the military and police got involved in the response, then trust fled the environment completely. And when trust was lost, sick people went underground, dead bodies, secret burials continued, riots escalated, rumors were rife, and the number of Ebola cases exploded. Eventually, we started to trust each other more. We started to collaborate more and cooperate more. And when this happened, something amazing happened. Some of the trickiest problems of the response, the solution started to come from the communities themselves. The lady you see before you is a survivor. For the tricky problem of hands-on care for the sick while staying safe, those who had gotten sick and survived were now immune, and they got involved with hands-on care for those that were still sick. The number of people that died, the number of cases that died dropped. For the tricky problem of monitoring people in the communities and making sure that those that were sick came forward for treatment, the community itself evolved structures. The natural leaders in the community, the chiefs, the women groups, the youth groups, the religious leaders, organized themselves and made sure that those that were sick were brought forward for treatment. They made sure that those that were in quarantine were taken care of. They were provided food and supplies to make sure that they stayed the full 21 days without coming out of quarantine. The community itself ensured that sick people, there was no burial of the dead, no secret burials continued. And then the country has long, porous borders that really proved difficult to monitor. The communities themselves started to police the borders. They evolved strategies that when they see strangers coming, they interviewed the strangers, found out their mission, and took their picture and wrote their names down so that to make it easier for them to track in case they ended up becoming sick people. Even experts in other areas got involved in the response. An avid motorcyclist outfitted a fleet of motorcycles with biohazard boxes and enhanced suspension. In these countries, there are really bad road networks, and during the rainy season, it's very hard for cars to gain access to some areas. This intervention and this innovation allowed every part of the country to become accessible. So these motorcycles will go in and go get blood samples from the most remote parts of the country. Even musicians got in on the action, and they started to sing songs. And the message now changed from Ebola kills to let's stop Ebola together. And eventually, in 2016, the outbreak was declared over. Now, trust We have, in Columbus here, we're grappling with different kinds of crises. There's the opioid crisis, the healthcare crisis, and even some crises that are more personal to you. And I say that trust must not be allowed to be a casualty, because when trust is abundant, the ingenuity of the communities themselves rises up to save the day and solves the problem. Thank you.